My name is Nick Spencer. I'm a radiologist and I'm AGFA's Chief Clinical Information Officer in our Northern Europe territory. I'm here today with Davide Ippolito from Monza in Italy to talk about his life in flow. Davide, welcome. Tell me a little bit about where you work and the sort of role that you have in radiology.
Okay, my name is Davide Ippolito and I work as radiologist at San Gerado Monza Hospital in the northern part of Italy. Our hospital is quite famous because it's quite close to the Formula 1 track, and so everybody knows the city about that. And our hospital is one of the high relevance and high specialty center in Italy, so it represents a tertiary referral center, and I have the possibility to be the Chief of Emergency Radiology and Innovative Technology. So my role is to organize the emergency department of radiologists and to make or try to make the better decision in choosing the correct technology.
What drew you towards a career in radiology as your clinical specialization?
In most of cases, I define myself as a radio oncologist because I'm a radiology with a passion for the oncology field, not only in make the correct diagnosis, staging tumor, but also in evaluating the new treatment and in the response of the treatment, because it's totally different from we learn in our history due to the immunotherapy and biological therapy and so on.
Can you tell me what areas of clinical practice you focus on?
Well, when I was a young student at the School of Medicine, I loved most of the medical specialties. And I understand about 20 years ago that the radiology may embrace all of the specialty at once. And I'm really lucky because 20 years later, now the radiologist has a pivotal role in everyday clinical practice, in multidisciplinary team, and you have the possibility to embrace most of specialties. You have to know a large part of the medical knowledge.
Enterprise imaging has been around for quite some time. How long have you worked with our software?
I think that we installed the new Enterprise Image. We moved from AGFA Impax to AGFA Enterprise Image in 2018 in September, and through a great collaboration we changed totally the system. We start working with a more flexible and reliable viewing mode. So 5 years ago, and now we are waiting for the new update, for the new release, and we are really happy.
That's really interesting. Can you tell me about some of your favorite features in our enterprise imaging solution?
Okay, it's not so simple to answer that question because there's a lot of features that we learned year by year or working in everyday clinical practice. And I think that one of the most useful is the possibility to look in one window and mix the different images acquired from different technology. Differently from the past, I have the possibility to compare CT with X-ray and MR at once in only one window. I can scroll all of the images, I can compare the results, and so I can build my mind combining information from a multimodality approach, as I defined. So I really appreciate the possibility that the system is so flexible in everyday clinical practice. Also, I really love also the chat system, because if I want to share one with my colleague some specific features, or if we want to help each other and giving information, show the key images, which is important to make the correct diagnosis. So the flexibility and reliability of the system is one of the most important features in my practice.
Yeah, absolutely, I agree. Tell me, how does this benefit your patients and your referrers from clinical practice?
Since the system works in a really automated way, we are able to retrieve in automated manner all of the information from previous examination. So it means that I waste less time in making some not useful operation. So I'm able to be more faster in look at the images, in make the correct diagnosis, in compare the image with previous examination. Since I work mainly in oncology field, I have the possibility to evaluate the evolution along of the time in a more simple way. And today the 80% of our report are performed within 24 hours. So since we installed the enterprise, everything has changed also in terms of speed of writing report.
And so moving on, can you tell me about the specific tools that help keep you in your flow?
Regarding tools, one that I really love is the key images. Because when we save a specific image that we can define as a target one, I can share it directly to my other colleagues. I can share to other colleagues in other departments. And so they immediately know what I've seen and what they have to look at. It is really useful for surgeon, for example, because it can look at the same image in the surgical room. It is really useful for the oncologist when I choose the target lesion and decide if we are in front of progression disease, stable disease, or according to the different response criteria. So, and it is useful for my colleague and for myself when we perform a long follow-up study, because we can save time and decide what is really important without avoiding any confusion with other features.
Thank you very much for your time today, Davide. It's been a real pleasure talking to you, and I hope you enjoy the rest of the show here at ECR in Vienna.
Thank you so much.